Next topic of discussion is diseases of bones and joints. First question is osteogenesis imperfecta. It manifests with the blue sclera, which are pathognomic of this disease. So osteogenesis imperfecta, it will manifest with the blue sclera, which are pathognomic of this disease. Second question is which of the following are the characteristic feature of cherubism? That means it premature exfoliation of the primary teeth will be there, and progressive painless symmetric swelling of the cheekbones. So once again the question is which of the following are the characteristic feature of the cherubism? The options are premature exfoliation of the primary teeth and progressive painless symmetric swelling of the cheekbones. Next, precocious puberty is most characteristic of which of the following? It is Albright syndrome. Okay, precocious puberty is most characteristic of which of the following disease? It's Albright syndrome. Which of the following diseases of the bone characteristically exhibit a single lesion in a single bone? Central giant cell granuloma. Which of the following disease of the bone characteristically exhibits a single lesion in a single bone? Central giant cell granuloma. Next, serum alkaline phosphatase levels are increased in Paget's disease. Serum alkaline phosphatase levels are increased in Paget's disease. Okay. Next, which of the following has potential of undergoing spontaneous malignant transformation? Paget's disease of the bone. Which of the following has the potential of undergoing spontaneous malignant transformation? It is Paget's disease of the bone. Which of the following are a triad of sign and symptoms of osteogenesis imperfecta? Blue sclera, brittle bones, and opalescent dentin. In middle-aged man, the radiograph shows cotton wool appearance and the blood investigation reveal an elevated alkaline phosphatase levels. The tentative diagnosis is Paget's disease. Generalized thickening of the cortical and cancellous bone is seen in infantile hyperostosis. Okay. Generalized thickening of the cortical and cancellous bones are seen in infantile hyperostosis. Next, clavicle is absent in cleidocranial dysostosis. Cotton wool appearance is seen in Paget's disease. A 3-year-old patient reports of painless progressive bilateral facial swelling. The tentative diagnosis is cherubism. Once again, 3-year-old patient reports of painless progressive bilateral facial swellings. The tentative diagnosis is cherubism. Generalized hyperpigmentosis is seen in Paget's disease. The primary causative factor for myofascial pain dysfunction syndrome of the TMJ is muscular overextension and overcontraction. The primary causative factor for the myofascial pain dysfunction syndrome of the TMJ is muscular overextension and overcontraction. Next, class 3 malocclusion is seen in all of the following. That includes cleft palate, cleidocranial dysplasia, and craniofacial dysostosis. Next, Down syndrome is associated with all except is a question, but we can change the question as Down syndrome is associated with the periodontal disease, premature loss of the deciduous teeth, and delayed eruption of the deciduous teeth. Next, delayed eruption of the teeth occurs in cleidocranial dysostosis. Okay, cleidocranial dysostosis. Next, the most common cause of TMJ ankylosis is trauma. False about cherubism is unilocular lesion. Alkaline phosphatase increases in Paget's disease as well as fibrous dysplasia. Next, the histopathology of osteopetrosis. Histopathology of osteopetrosis shows endosteal bone formation and lack of normal bone resorption. Okay, these are seen in osteopetrosis histopathology. Next, complication of rheumatoid arthritis of the condyle is fibrous ankylosis. Next, multiple fractures are seen in osteogenesis imperfecta. Of the following, which is most common disorder causing pain about the masticatory apparatus, including the TMJ? Myofascial pain dysfunction syndrome. Next, in myofascial pain dysfunction syndrome, which muscle is most apt to exhibit tenderness? It is lateral pterygoid. Biochemical abnormality associated with osteogenesis imperfecta is increase in phosphorylase enzyme. Next, Orange peel and ground glass radiographic appearance is observed in the case of fibrous dysplasia. Next question is, the treatment for a child with cherubism is cosmetic surgery after puberty. Next, delayed dentition with multiple supernumerary teeth is seen in cleidocranial dysplasia. A patient complains of loss of visual activity, deafness, and enlargement of the maxilla. The patient is suffering from Paget's disease. Large anterior fontanelles, open sutures, slanting eyes, decreases sexual development, macroglossia, and enamel hyperplasia are seen in Down syndrome. Next question is, amber colored tooth translucency, blue sclera, and the bone fragility and history of the previous bone fractures are the characteristic findings in osteogenesis imperfecta. Mosaic pattern of bone is seen in the radiographic features of Paget's disease. Normal serum calcium and alkaline phosphatase are seen in cherubism. The most common complication following rheumatoid arthritis of the TMJ is ankylosis. A patient with multiple impacted supernumerary teeth and can bring his shoulders together is suffering from cleidocranial dysostosis. Which of the following statements is false in relation to myofascial pain dysfunction syndrome? We can change the question and we are reading the correct statements only. Okay, so in myofascial pain dysfunction syndrome, it mainly affects young females. It is caused by the muscle fatigue due to chronic oral habits as grinding and clenching. Then, treatment involves construction of the occlusal guard and stress-free emotional condition. Next question is, corticosteroids are useful in the treatment of TMJ arthritis because they have an anti-inflammatory effect. Next, a child with Down syndrome has moon face, is retarded mentally, and which of the facial characteristics? Maxillary hyperplasia. Next, a 10-year-old child presents with anemia and recurrent fractures. The X-ray shows diffuse hyperdensity of the bone. The diagnosis is most likely to be osteopetrosis. Ground glass appearance in bone is seen in fibrous dysplasia. Next question is, pain, muscle tenderness, clicking or popping noise in the TMJ and limitations of the jaw motion are the 4 cardinal signs and symptoms of myofascial pain dysfunction syndrome. Next, a non-neoplastic hereditary bone lesion, histologically similar to central giant cell granuloma, affects children and shows a bilateral involvement of the jaws with the eye to have an appearance. Clinically is cherubism. Albus Schonberg's disease is osteopetrosis. Treacher-Collins syndrome is mandibulofacial dysostosis. Immature bony trabeculae are found in fibrous dysplasia. Next, osteosclerosis of the bone occurs due to increased host response. During a routine checkup, a 70-year-old male is found to have serum alkaline phosphatase 3 times the upper limit of the normal. Serum calcium, serum phosphorus, and liver function tests are normal. The most likely diagnosis is Paget's disease of the bone. Next, venous malformations involving the leptomeninges of the cerebral cortex is a salient feature of Sturge-Weber syndrome. Next, a patient 18 years of age with a sebaceous cyst on the scalp and back of the neck and osteoma on the right mandible. Radiographs reveal multiple impacted supernumerary teeth in the both jaws. These findings suggest Gardner's syndrome. Next question is, preauricular pain, grating sensation, and partial trismus are the symptoms of TMJ pain dysfunction syndrome. Next, in cleidocranial dysostosis, sometimes the roots of the permanent teeth are thin and short. Polydactyly, craniosynostosis, late closure of the fontanelles is a feature of Apert syndrome. The most likely diagnosis in a 23-year-old mentally alert male dwarf with a disproportionate arm and leg to body growth, prominent forehead, and retruded maxilla is achondroplasia. Osteosarcoma characteristically may develop in some cases of osteitis deformans. Next, a patient with fibrous dysplasia can be treated by conservative surgery. Histopathologically reversal lines are seen in Paget's disease of the bone. In a 60-year-old adult, which of the following diseases cause expansile maxillary lesions? Paget's disease. Most common primary malignant bone tumor is multiple myeloma. Transformation into osteosarcoma is seen with Paget's disease and polyostotic fibrous dysplasia. Which of the following is not a clinical feature of Pierre-Robinson syndrome? So we can alter the question as which of the following are the clinical features of the Pierre-Robinson syndrome? It includes micrognathia, glossoptosis and retrognathia. Next question is, eruption fails in this bone disease as there is no bone resorption. Osteopetrosis. Paget's disease of the bone is a chronic disease of adult skeleton. Mutations in GNAS1 gene is associated with fibrous dysplasia. A patient aged 50 years presents with a history of the jaw expansion and enlargement of the maxilla. Most likely diagnosis is Paget's disease. Multiple myeloma has been seen commonly after exposure to radioactive isotopes. Next question is, the granulomatous tissue that is responsible for destruction of the articular surface of the TMJ in rheumatoid arthritis are known as pannus. Next, hypercementosis of the whole dentition is seen in Paget's disease. Which among the following are associated with increased incidence of osteosarcoma? Paget and polyostotic fibrous dysplasia. Osteoporosis is seen in all except hypervitaminosis. Which of the following syndrome is caused by mutations in patched PTCH gene? Gorlin and Gold syndrome. The fastest growing human cancer, which doubles in size every 1 to 3 days, occurring in young children, manifesting as rapidly growing extranodal jaw tumor is Burkitt's lymphoma. Noonan syndrome is associated with cherubism. A relatively young person complaining of the solitary, painless fusiform enlargement of the maxilla, which is firm and smooth and with a normal overlying mucosa, has radiopaque ground glass appearance. A possible diagnosis